Prioritize and notify team or person concerned. Write a short list of your priorities on taking over the ward. Now, just like we mentioned earlier on, you should have a small list of your priorities of the patient. Which patient is the sickest? That is the one that is most needing attention. That type of patient should be the top of your list. And then your ABC, that is airway, breathing, and circulation. Which of the patient is having such issue? Then, of course, which patient is in severe pain? And then which patient is due for surgery? And then, of course, which one is due for medication and when? These are lists that you should arrange so that you now try to address these patients and give them the necessary care that they deserve. Now, after doing that, you should brief your team. For instance, if you are two in the ward, or as you are about to close, you should indicate, for instance, bed 3, you should add the name of that patient. Is a priority because that bed, the patient there is a CVA. The BP, that is cardiovascular accident, the BP is 200/110. And then what have you done? You place this patient on oxygen, 2 liters, and then you have called doctor, and you are still assessing the patient's condition. You pass a very important message to the next duty nurse. Then you can escalate early enough using the SBAR. That is Situation Background Assessment Recommendation. This is a kind of a tool that is being used to escalate so that you document, so that how to call the attention of those concerned, the doctor or any emergency team. So we call it SBAR. Now, expectations. Your team expects leadership. Doctors expect clear data and not panic. So under no condition should you become panicky. You become confused and then don't know what to do, because that is not what your team members expect from you. They expect leadership from you. Remember, you are one of your this is that you are a CEO. As a CEO, they expect leadership from you, and then as a CEO, adequate and correct data is expected from you. Then G, give care and guard standard. Then you start ADPE, that is assessment, diagnosis, planning, implementation, and evaluation. This is the 5-step method of every registered nurse must use to give safe patient-centered care. Nursing and midwifery council normally test it in every exam. It is expected that applying it in high risk within 15 to 30 minutes can save the patient's life. 2, you should educate the patient and residents immediately. If a patient has been booked for surgery, you should educate them. What are you to educate them on? The need for them to sign consent form, the nil per os, that is NPO nil per os, that is they should not take anything orally. Maybe a few hours. You should tell them when to stop eating. Now, if the patient is booked for surgery, for instance, 8 a.m. the following morning, expectation is that you should starve this patient, or you should fast this patient as you can inform them that after taking your last meal by 10, you should stop taking any other thing. Then uphold patient safe dignity. Now, hospital is where, despite the condition of the patient, you are expected to, hold the patient the dignity. So privacy during procedures. You must use the screens when you are carrying out procedure on the patient. Then, of course, you must always seek the consent of the patient before you touch the patient. and inform the patient what you want to do on the patient. Now, the expectations. Relatives expect explanation. Nursing and midwifery council expects careful charting from the very first minute of the shift to the end. Now, let us try to look at this table. Who want to what from you as a nurse on duty? Now, number one, the stakeholder, that is one of the stakeholders, the patient. What do they expect from you? The patient expects you to keep the patient safe, relieve my pain, explain what you are going to do to me in my language. In the language, you need to explain to the patient in the language that the patient understands what you are going to do. If you don't speak the patient, you should try and find who understand the patient language and try to pass the information. Now, if you fail, what are the consequences if you fail to do this to the patient? The patient might lodge complaint against you. That is even the smallest one. And then if there is trauma, the patient can sue you. Now, the second stakeholder is the hospital. Now, what does the hospital expect from you? The hospital expects you to prevent errors, save cost, follow the hospital policy, and then there should be zero faults. That is, patients should not fall during your shift. You should not, for whatever reason, allow patient to fall. The hospital does not want to hear the patient fall during your shift. If you fail to do this, what are the consequences? The consequences of not, preventing errors, saving costs, allow the patient to fall, not following the hospital policy. The consequences by the hospital is that they will query you, and then it can even lead to dismissal. And if the fall is fatal, it can lead to civil suit. The patient might sue you. So, my younger professional colleagues, you should always take note of this. These are some of the things that is expected of you immediately you've been employed as a nurse. Now, the other one is Nurse and Midwifery Council, another stakeholder. Now, what do they expect from you? The Nurse and Midwifery Council expects you to uphold the code. What are those codes? You should prioritize people, practice effectively, preserve safety, promote professionalism. This is what nursing and midwifery expects you to carry out at all times as a professional nurse. You should uphold these are 4 cardinal principles of nursing and midwifery council. Prioritize people, practice effectively, preserve safety, promote professionalism at all times. Now, the consequences if you fail to do so, the Nursing and Midwifery Council Tribunal will sit and then suspend you. When they suspend you, they may even go as far as striking your name out of the Nursing and Midwifery Council register for failure to uphold these 4 cardinal principles. Then, of course, the doctor that we work with, they are also another stakeholders. So what do they want, or what do they expect from you? They expect accurate data, carry out orders safely, then question them if they give an unsafe prescription or order. You should question them. That is why, as scientists, you should know your onions. You should know what you are serving. Because if, for instance, doctors are human beings, they can make mistakes. If, for instance, quinine, we've seen a situation where quinine was served, and then because it was served wrongly, there and then the patient died because of the way. And it was based on prescription. And we've equally seen a situation where I think Benelin with choline was served in one of our hospitals. And then to a stethoscope asthmatic patient, a patient that is very, very asthmatic. I know that is it is contraindicated, but a doctor prescribed it. But because the nurse knows what she was doing, she said, this thing is not correct. If I serve this patient this drug, it will further depress the respiration. So I'm not going to serve. And then the matter was taken up and she stood her ground. And then the management, credited her. She won the case. So what are the consequences of not, what are the consequences if you didn't carry out the accurate data or carry out orders safely, or you did not question unsafe orders? The doctor will lose stress on you. He will lose trust on you. The patient will be harmed. And then hospital management board, hospital management will carry out disciplinary action against you. Now, to your colleagues, your colleagues are another stakeholder. And then what are they expecting from you? They expect you to pull your weight by communicating. You communicate effectively with them, and then you should back them up in terms of crisis. We have some situation where maybe there might be crisis in the world, and then your colleagues are in the right, but because you are afraid of the management, when they are putting pressure on your on your colleague, instead of defending your colleague, you side with the patient. With the management, which is wrong. So if you